Welcome to Say More from Boston Globe Opinion. I'm Shirley Leung. Sometimes a news story starts an overdue conversation. This week, that conversation is about health insurance in the U.S. The CEO of the largest private health insurer, United Healthcare, was murdered earlier this month on the streets of New York City. What followed was a passionate discussion. Is health insurance so bad that it would drive someone to murder? Everyone has an opinion. I'm joined by two experts who can talk about the backlash and why United Healthcare has become such a target. Casey Ross is an investigative reporter with Stat News, a health news site which is a sister publication of the Boston Globe. Also here is Vikas Saini, the head of the Lown Institute based in Massachusetts, which advocates for social responsibility in health systems. Welcome to both of you.
Thanks for having us. I'm glad to be here.
Yeah, thank you.
So, Casey, when all this news was coming out about the murder of the United Healthcare CEO, I immediately thought of you because of your investigation into how United Health Group used artificial intelligence to deny coverage. That series that you did with your colleague, Bob Herman, it got a lot of attention and it was a Pulitzer finalist this year. Remind people what your investigation found.
Well, what we found was that United Health and its subsidiary NaviHealth were using a predictive algorithm in order to deny people post-acute care services. So, and post-acute care services are services that you receive after a hospitalization. So these very ill older people that suffered falls or strokes or other serious injuries and illnesses would have a hospitalization. And then in talking with families around the country that were denied, their care was cut off prematurely before they were ready to go home. And we just found that the algorithm was being used in a way that harmed a lot of people and produced positive financial results for United Health.
And so what was your reaction when you saw that the United Health CEO was gunned down?
Well, it was a shocking crime and awful. And as a reporter, you just kind of go into reporting mode. And I just wanted to know, I think like everybody else did, what happened and why did it happen? What were the motivations?
And Vikas, you were a cardiologist for decades, and now your work, you're kind of steeped in the world of health insurance reform. I have a little audio here from Senator Elizabeth Warren. She was recently on MSNBC reacting to the CEO killing.
What happens when you turn this into the billionaires run it all is they get the opportunity to squeeze every last penny.
Yeah.
And look, we'll say it over and over. Violence is never the answer. This guy gets a trial who's allegedly killed the CEO of United Health. But you can only push people so far. And then they start to take matters into their own hands.
Yeah.
So Vikas, what do you think of Warren's comments?
I think her comments are directionally really right in the broadest sense. You know, this guy did what he did, and I'm not going to absolve him for his crime because somehow there was some injustice. But she's not wrong that, you know, in a society in which avenues for reform or ways to fix things seem to be repeatedly shut off or closed down, when more and more the ability to appeal to a human being is transferred to an interactive voice system that drives you crazy, a chat bot that drives you crazy, it will boil over. And the general trend of dissatisfaction, irritability, lack of an outlet or lack of an ability to appeal, all these things, I think, are in the mix. So in that sense, when Warren says you can only push people so far, she's not wrong.
Vikas, you had mentioned during our pre-interview about a comedian, that you had watched a comedian, right? And making some comments about health insurance. Can you share that story?
Yeah, I was just, relaxing one night watching a stand-up comedian on YouTube. His name is Nimesh Patel, Patel. And he's going on about all sorts of things about, South Asians and Indians and, the usual shtick, in New York in terms of ethnicity. And somehow it turns to healthcare in the middle. And he literally says, before I say anything, let me just say, American healthcare is a criminal enterprise. But then what really floored me and told me, we got a problem here is the audience reaction.
Healthcare is a criminal enterprise.
Which was applause, cheers, practically unanimous.
I wasn't concerned about getting COVID and dying. When it's your time to go, you go. I was concerned about getting COVID, being in a hospital for 2 weeks, and then coming out with a bill for $2 million. That's what I was terrified of.
And the other thing that struck me was this is a young crowd. These are people in their 30s. There aren't people who have a lot of interaction with the healthcare the way seniors do, but they have enough. And this was a year or two ago. So this really, to me, indicated that something is seeping into the culture and popular consciousness that people in healthcare really would do well to pay attention to.
So what do you think are the types of things that make people the most upset when it comes to their health insurance companies? Casey, maybe you can kind of start off on this.
I mean, I've talked to so many different families and people who have encountered the bureaucratic process that surrounds healthcare. The thing that makes it hardest for them is that when they are fighting for their life or the life of a loved one, they are made to go through a careless bureaucracy that forces them at every turn to put in more paperwork, to search down more data, to find different ways and more ways to justify the care that their doctors have recommended and that they can't get because they're being told no, or you don't qualify for this, or there's this exclusion you didn't recognize. It's really, really painful and it's disempowering, and they don't know how to fight back. When a denial, for example, is conveyed, the rationale for it isn't clear. It's not even explained, nor is there really any immediate way to quickly appeal that if you're a patient. You have to go through this process, and it's long and it's hard, and you're just trying to cope with your grief and the difficulty of dealing with a loved one or your own infirmity, and then you have to figure out this maze that you can't figure out. It makes it impossible for people, and it results in the anger that you see and hear.
I was recently, filling in on the radio, and we had a call-in, right? We had listeners call in about their experience with the health insurance company. And I just remember this one woman who called in. Actually, I have to say 9 out of the 10 callers were like Elizabeth Warren. They were basically saying that people are fed up with their health insurance companies, so it's not surprising that someone out of frustration would shoot the CEO and kill him. And there was this one woman who got on the phone, called in, and she was talking about when her daughter was a newborn, and they're in the hospital, and she needed a feeding tube so that she could survive. And then I guess the health insurance had a nurse come in. Once they put the feeding tube in, the health insurance had dispatched a nurse to tell the parents, oh, by the way, the food that's coming from the tube, that's not covered.
Oh, my God.
And you could hear a pin drop, when she said that. And she said, luckily, they were in Massachusetts. There were other ways to get money and to get the food paid for. But she was like, there was zero empathy in that moment, that, her daughter's fighting for her life, or her newborn is fighting for her life. And the insurance company, had to worry about money at that moment. I mean, and I'm sure there are lots of stories like that, right?
Yeah. Right. I mean, you asked why people feel that way. That is a perfect example. But let me just say, I'll just go there. There's plenty of anger to go around. And insurance companies are part of the story, but not the whole story. So if we look at the question of, for example, medical debt, Kaiser Family Foundation has a survey that shows 100 million Americans 100 million Americans have had some experience with medical debt. That's a stunning number. But when you start digging into that, what it really is to make healthcare, quote unquote, affordable, we've been selling these high deductible, high copay plans. And it ends up being a crapshoot because you're saying is, gee, I won't get sick, but if I get sick, then I'll have to pay more. So I'm betting I won't get sick. But when you get sick, suddenly those out-of-pocket costs are way more than a, $5 copay. There's a lot there. And where are those why are those costs so high? Why are these high deductible plans where they are? The answer is because nobody in leadership or in authority or across the various cartels of the medical industrial complex has managed to get together and say, listen, we gotta figure out the cost structure here or the American people are going to go under. Mm-hmm. And that's what's happening. So what we have is the health insurers will say, we'll offer you these affordable plans. The hospitals say, we're getting stuck holding the bag here with these high deductible plans. Now we got to go after people. So we're the bad guy. But at the end of the day, it's very much about the entire system and how it's organized. And how it's organized is very expensive, and how it's organized is permissive of price increases. And there's no countervailing force to hold or restrain or control prices. And the net result is, the system that we have.
Casey, give us some context about United Healthcare. I mean, is it the worst offender in terms of healthcare companies that delay and deny coverage? Where does it rank?
Well, I think because of its size and scope and reach, United Health is responsible for a larger portion of the denials and the friction in care that people experience. A lot of people don't realize how big and expansive United Health Group is. Myself and my colleagues at STAT have set out to sort of take a look at the conflicts of interest that are embedded within its business empire. And it's just become very clear through our reporting that there is a tremendous amount of angst among both doctors and patients about the difficulties that they encounter in dealing with its bureaucracy, the price increases, the way that United, because it owns the insurer and the provider, is able to bend clinical practices in ways that demonstrably harm patients and providers while benefiting financially United Health.
Well, Casey, let me just jump in and add something. I think another way of saying this would be that United, a large insurance company that spends a lot of time and effort reviewing claims and denying a lot of claims, is increasingly owns the doctor's practices that are going to provide your care. And so that creates really a fraught set of circumstances. The healthcare system's evolving towards these mega entities that are both the insurer and the doctor and the hospital and the who knows what. And maybe they're all going to duke it out like, Godzilla and King Kong. But the little people who are the patients who are supposed to be what this is all about are just getting lost in the shuffle.
I mean, Vikas, you raised a good point, and I mean, jumping off of what Casey was describing, it sounds like United Healthcare is like the 8,000-pound gorilla. It's not just the 800-pound. I mean, that's how big it is. So would the government or anyone try to break them up?
Well, you're in the heart of the question about monopolies, in the economy in general. It's a hot topic. The incoming Trump administration has given signals that when it comes to some of the big tech firms, they may continue Biden's policies around, anti-monopoly lawsuits and the like. But when it comes to healthcare, everything's getting big fast, and there are monopolies and near monopolies, and certainly in certain parts of the country, there's a single health system, there's a single insurer. And what the remedy is, I think, should be topic number one in terms of public policy, because you might be able to achieve something by breaking things up. But my own view is some of these trends are way past the point of being able to do that in a way that is actually practical.
I would just point out also that United Health Group is under an antitrust investigation by the Department of Justice and has been for the past year. The Department of Justice just sued to block its acquisition of a home health care provider called Medicis. The company on that front is under an awful lot of scrutiny. We don't know where that's going to lead, but the antitrust investigator who's in charge of that division within the Department of Justice just gave a speech at Carnegie Mellon where he laid out a lot of the concerns that have unfolded from an economic perspective about the consolidation that's occurred in the marketplace, particularly relating to United Health strategy, which is known as vertical integration, where you buy companies in adjacent markets to yours so that you're controlling both sides of multiple transactions. And it's just become a huge, huge source of concern for economists and for government investigators.
Let me also add something here, which is, if I put myself in the shoes of United executives, this is the direction of the world, and you'd be foolish to not anticipate your competitors doing the same thing. I mean, that is the logic of the marketplace as we've framed it. So this idea has been around a long time, and if I were United, I'd say, let's get there first.
More of my conversation with Casey and Vikas after this short break. So, Casey, do you think the experience of dealing with health insurance is actually getting worse for people? It sounds like it's certainly getting more expensive, right?
I think the collisions are happening more. There's so much more that medicine can now do for you. If you think about like medicine and healthcare and like the 50s, 60s, 70s, or even 80s. I mean, there's just so much more in terms of the interventions, the medications, the procedures, the surgeries, the things that it can do. And it's gotten so expensive and people are so sick. There's just so much collision happening between people needing care, the care being so expensive and so capable of helping people, but that results in these really huge costs. I mean, 20% of GDP. I mean, it's a stunning thing that's occurred. And, it's a really complex problem, and it's going to take a lot of really hard work by smart people to begin to make this better.
Vikas, what do you think are the solutions to this? I mean, obviously it's not murder. So what is it?
First of all, I'd say that, a lot of the anger and upset with the insurance companies is really the bureaucracy around prior authorization, denials, et cetera. And I think there's no reason we couldn't simply abolish those. You'd have to rearrange who's responsible for the spending. And, there are ways of managing that so that the insurance company is simply the administrator of the funding and the claims adjudication, a bunch of other things, without necessarily getting in the business of managing the appropriateness of the care. But somebody has to. So, in terms of the question of what can the public do, that's more complicated, because then you get into the fact that our political system in many ways seems, quite broken. We don't seem to be able to translate public sentiment and public opinion into policy in a meaningful way, at least not mass sentiment. Individuals and more influential groups, they get their way, but as a society, it's not working.
I mean, Bernie Sanders tried to change the system, right? I mean, when he's running for president and some kind of Medicare for all, universal coverage. I mean, or single payer, I should say, some kind of single payer program. I mean, would that ever happen here? I mean, it seems like other countries don't have the problematic medical system that we do.
Other countries have other problems. Let's put it that way. But no, none of them have this particular problem for sure. The U.S. is a complete outlier. And I think the most telling statistic there is when you look at the amount we spend relative to our life expectancy. And the U.S. is a complete outlier compared to all the other OECD developed countries. But what's most interesting when people look at graphs like that is it wasn't always so. You know, in the 60s and 70s, it wasn't the case. It was around 1980 that the U.S. started becoming an outlier, and over 40 years, we've become way out there, which is to say we're spending more and more and getting less and less. So there's a lot of things. If you want to make America healthy again, there's a lot of things that do need to get rebalanced and shifted. Certainly, there's a lot of things related to prevention and nutrition, but primarily a rebalancing of the delivery system, which means more primary care. So you could imagine if there were organized efforts to rebalance where care is delivered, how it's delivered, by whom it's delivered, and if people were engaged in that in their own communities, I think that would have a much bigger impact. With all due respect to Bernie Sanders, and I have a lot of respect for him and for what he did in bringing this topic, you know, to the national stage, you know, one guy and a slogan and even great legislation is not how change actually will happen. It'll have to happen with lots of people putting their shoulder to the wheel locally, regionally, and nationally.
Casey, what are you hearing from health insurance companies themselves? Do they see this murder as just some one crazy, patient, or are they looking inward? Maybe we need to treat our customers a little bit better.
Well, there was a very interesting op-ed that was published by the New York Times, and it was written by Andrew Whitty, who's the CEO of United Health Group, after this murder. And there was some acknowledgement in the piece that, we know the healthcare system doesn't work right, and it's not as good as it needs to be for people. And there are parts of it that could be better, and we're responsible for some of those things. So there was some acknowledgement that there needs to be sort of a conversation. I think there's some defensiveness and some anger and some grief on the part of, certainly within United Health Group right now. But there's also, I think, a sense among these companies that they know, they see in the vitriol that people are very unhappy, and that's maybe something has to happen differently.
I'd like to chime in that, this murder is kind of a punctuation mark. It's a moment. I don't know what this guy's motivations were, or what he was thinking or not thinking. I mean, it's kind of lunatic. It's kind of a form of terrorism, and it's nothing justified it. No matter what he had or thought, nothing justified that. The real conversation should be about what we are talking about, which is the mass sentiment around what happened. That mass sentiment has been there and is going to continue to be there. And in that sense, this is a moment for people to try to step up and address it.
Well, Casey, Vikas, thank you so much for being on Say More. Casey Ross is an investigative reporter specializing in data and technology for Stat News. Vikas Saini is the head of the Lown Institute, which advocates for social responsibility in our health systems. You can read his op-ed on this subject on Boston Globe Opinion. Thanks to both of you.
Thanks for having me.
Thanks so much for having me.
Say More is a production of the Boston Globe. Today's episode was produced by Anna Kusmer. Our editor is Jim Dow. Our engineer is Uzair Ahmed. Our music is from APM Music. If you like the show, please follow us and leave us a review on Apple, Spotify, or wherever you get your podcasts. You can email us at saymore@globe.com. I'm Shirley Leung. Thanks for listening.